70-year-old Michael Kinchelow is an active husband, father, grandfather, and cancer survivor.
2 years ago, it was discovered that I had bladder cancer, and the course of treatment was to decide to remove my bladder as well as take chemo.
In addition, he received a urostomy and a stoma to redirect the urine out of his body.
Approximately 10 days after I had the initial bladder removal, I did have what they call emergency surgery because I had a ventral hernia form, which meant my organs inside were pushing through a lot of the stomach wall.
Doctors told him the hernia surgery was a temporary fix and he would need another one in the future. When he started having symptoms again, he knew it was time to do something about it.
There really is no pain in my case, and it's more a question of becoming uncomfortable to exercise or to move or to pick people up or grandchildren up.
As the grandfather of 4, spending time with his family is very important. He did not hesitate to contact Dr. Eric Pauli at Penn State Health, who specializes in hernia repair for ostomy patients.
When you talk about fixing hernias around stoma sites, it's a challenge. How do you fix a hole but leave a hole? How do you get the intestine out that's not supposed to be there but leave the right loop behind? And so that's the particular challenge in his case, is fixing the hernias around the ostomy site.
Made me feel very comfortable immediately because of the fact that he said this is something he does quite often, working with hernia or stoma patients.
Michael and Dr. Pauli discussed his options and chose the best one for his complex case.
The kind of repair that he got is actually a repair that we developed here at Penn State. It's called a retromuscular sugar baker repair, and that includes swinging the stoma around the edge of the mesh to come up so that we don't have to cut the mesh around the bowel. We don't need to cut the mesh in the midline where his hernia is, and it fixes the hernias he has in the middle and the hernias around the stoma site all at once.
After the surgery, Michael spent a few days in the hospital. He quickly realized how this procedure gave him his life back and is very thankful.
We do these complex repairs to give people a normal life back. We want them to be living a normal life, doing any activity that they want down the road. And so after they're fully recuperated, we don't really put activity restrictions on what people can and cannot do.
It wasn't always necessarily life-threatening to me, but it affected my day-to-day living, I think. And now I'm back to being about as close as a normal as a 7-year-old can be, I suppose.
Patients like Michael do have a higher risk of having hernias return. The risk is 5 times higher than that of patients without stomas. For now, Michael is enjoying life with his grandchildren.